Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternity and the nursing students to have a continuous learning in their profession. So today we'll be seeing about nutritional problems. So as a nurses, why we have to consider the nutritional problem is because when we provide a good well balanced diet and depending upon their disease condition or due to the deficiency of vitamins, the most of that is 85% of their health gets improved. So for that purpose only we have to more concentrate on the basic needs like nutritional problems. So nutritional problems, if we consider, we should not only see about the undernutrition but also we have to see about the overnutrition, because in the present days the students or the babies are using more number of the screen time. So that screen time increases the overeating in the food and that causes the childhood obesity. If they are having the childhood obesity in the present time, it will lead up to many complications when they do go for the adulthood. So we'll see about the nutrition. It's a selection of food and preparation of food and their ingestion to be assimilated by the body. So when we practice a healthy diet in our health, many of the health issues can be avoided. So the diet of an organism is what it eats, which is largely determined by the perceived food. So whatever the nutrition we are taking, that is whatever the food we are ingesting, it should be healthy. If we are taking that food in a healthy way and when it is correlated with the recommended dietary allowance of that particular age, that will cause a health improvement in their status. So the major nutrients we are going to see is proteins, carbohydrates, fats, minerals and vitamins, and also micronutrients and kilocalories. We will see about the relation of nutrients to health. So as we have already discussed, a good nutrient means maintaining a nutritional status that enable us to grow well and enjoy health. Good nutrients is essential for normal growth and development, intellectual development as well as for learning and behavior development. So good nutrition is essential for promotion of health and prevention of specific nutrition deficiency like kwashiorkor, marasmus and blindness. For each and every vitamin deficiencies we have a disorder. So for example, we have a deficiency of vitamin A, it causes night blindness, and in the same way if we have a deficiency of vitamin C, it causes a bleeding in gums causing scurvy. So when the body lacks a particular nutrition or vitamins, that will end up with some of the disorders. That minor ailment will lead to a major complications in the person. So when we are getting a minor symptoms in our body related to nutrition deficiency, we should not ignore it. We have to immediately seek the dietitian or the physician or the medical professionals to aid the nutrition in our diet and also to compare our nutritional pattern with the recommended dietary allowance. For example, a lactating mother needs more kilocalories than a non-pregnant mother, non-lactating mother. So in that way we have to compensate our nutrition, kilocalories, carbohydrates, vitamins, minerals, fats and protein content. So when we come to know that whether we are consuming either undernutrition pattern or overnutrition pattern. If we are consuming undernutrition pattern, we have to correct it by improving the nutrition pattern. If it is overnutrition, we have to reduce the kilocalories. The malnutrition predisposed to infections and it may affect the food intake, absorption and metabolism. So one of the major effect of malnutrition is high death rate, high infant mortality rate, high sickness rate and lower health expectation rate. So when we consume proper amount of nutrition only, the body will receive a good amount of immune power or metabolism will take place properly. And also for example, a particular child or any adult is having a iron deficiency anemia, they will be exhibiting some of the clinical symptoms like easy pluckable of hairs and brittle nails like that. Next is overnutrition, also we will see. It is responsible for obesity, hypertension, cardiovascular and renal diseases and disorders of liver and gallbladder. So from this it is very clear that either undernutrition or overnutrition, a diet is always plays an important role in certain types of gastrointestinal cancer also. So we are coming across many of the CAs in many organs, we are coming across the word cancer. So diet also plays a major role in occurrence of or the incident rate of the gastrointestinal cancer in a individual. And in the same way, we as a nurses not only ignore the overnutrition, we have to consider both undernutrition and overnutrition. So how and all you can assess the nutritional statuses? It is a format of A, B, C, D, E. A for anthropometric measurements, B for biochemical evaluation, C for clinical examination, D for dietary assessment, and E for ecological factors. Another thing is vital statistics, that is you have to you have to get the information about the morbidity and mortality rate. So risk factors, who and all are at the major risk for the nutritional problem is pregnant women and lactating women, because they need more amount of kilocalories and other nutrients. Next, infants and preschooler, adolescent girls and elderly, that is geriatric population. Why adolescent girls or boys come in this categories? Because of their beauty conscious, and they lack various nutrients. They don't eat proper food, they go for a diet management, and that to a improper diet management. For that purpose also, the adolescent girls are the risk factors for nutritional problems. So infants and preschool children, due to the poor dietary habits, that is the difficulty in feeding them, that all causes them into this risk factors groups. And geriatric populations, due to some of the physical conditions like unable to swallow, heartburn, so some gastrointestinal disturbances like vomiting and nausea, these all causes the less intake of food in the geriatric populations. And pregnant women, lactating women, same, due to their high amount of consumption of food, they need more kilocalories. Next is causes of nutritional problems: population growth, agriculture and food production. When there is a high amount of population growth, there is a scarcity of the resources, and we in our country, it is unable to fulfill all the stomachs of the individual. So due to the less production of food. Next, prevalence of parasitic and infectious diseases, religion and cultural food fads, general illiteracy and ignorance illiteracy, economical barriers. So economical condition also affects the and one of the major cause of the nutritional problems. And in the same way, religious and cultural food fads, in some of the religions or cultures, they will not be consuming some particular type of food. For example, in particular religion, they are not consuming fishes. So the omega-3 fatty acid that is present in the fishes is in abundant amount. So that person who is ignoring that fish will have a lack of those omega-3 fatty acids. So when we compare with the other plant, the fish contains more amount of that particular nutrient. In the same way, in each and every nutrient, in each and every food, they have their own nutrient pattern. If we are ignoring that particular food or any particular vegetables or fruits, we will lack that particular nutrient which is not available, that is that much not available in other sources. Next is general illiteracy and ignorance illiteracy. Some may not have information about the nutrition problems. Some will have the information, some will have the knowledge regarding the nutrition problem, but due to their neglect and ignorance, that will end up with the causes of nutritional problems. Next is prevalence of parasitic and infectious disease. If we are having some of the disease conditions, so our nutrition patterns get affected. In the same way, that is also one of the cause of the nutrition problem in the children's or adult population. So these are the causes of nutrition problem, that is population growth, that is increased amount of population growth, and scarcity of the resources like agriculture and food production, and prevalence of parasitic and infectious disease. Next is religious and cultural food fads, general illiteracy and economic barriers. So we will now one by one see about what are the major nutritional problems. So we will see about in detail. First is protein energy malnutrition. It refers to a form of malnutrition where there is an inadequate protein and calorie intake. It is considered as primary nutritional problem in India. The protein energy malnutrition is due to the food gap between the intake and the requirement, that is deficiency of the intake of the required dietary allowance. Next is causes and risk factors: inadequate intake of food, diarrhea, respiratory infections and measles. So these are some of the causes of protein energy malnutrition. So next we'll see about the assessment of protein energy malnutrition. So according to Gomes classification, the weight for age is equal to weight of the child by divided by weight of normal child of the same age multiplied by 100. So according to Gomes classification, it's between 90 to 110 percentage. It is a normal nutritional status, and it between 75 to 89 it is considered as a mild malnutrition, that is first degree malnutrition, and 60 to 74 is considered as moderate, and below 60 is considered as severe malnutrition. So we'll see about in protein energy malnutrition. First is kwashiorkor. It is a form of malnutrition caused by not getting enough protein in the diet. So second is marasmus. It is a severe form of malnutrition that consists of chronic wasting of the fat, muscles and other tissues in the body. That means these babies will resemble like an old man's face, like that. Next is how we can prevent it. So oral rehydration therapy helps to prevent the dehydration caused by diarrhea. Exclusive breastfeeding for 6 months thereafter supplementary food. Immunization for infants and children. Nutritional supplements can be given to the babies. Early diagnosis and prompt treatment prevents this protein energy malnutrition. Family planning, nutritional rehabilitation, promotion and correction of feeding practices. So you have to identify as a nurses how the feeding pattern of the child is, that is how many amount intake of protein is there, how many amount of carbohydrates the baby is intaking, and what are the kilocalories the baby is intaking, and you have to correlate with the recommended dietary allowance, and you have to prevent and you have to give the proper nutrition. Next is vitamin deficiency. Overweight and obesity are defined as abnormal or excessive fat accumulation that presents at a risk of health. It is estimated 25,000 children go blind every year. About 20% of total blindness in India is due to vitamin A deficiency. So vitamin A deficiency causes a night blindness and xerophthalmia. It is a common in children aged 1 to 3 years. It is often related to weaning. It is a dry eyes refers to all the ocular manifestations of vitamin deficiency in man. It is a serious nutritional disorders leading to blindness. Next we'll see about nutritional anemia. It is a disease syndrome caused by malnutrition, a condition in which the hemoglobin content of the blood is lower than the normal as a result of deficiency of one or more essential nutrients. So majority of the vulnerable populations are being affected by the iron deficiency anemia. This is the categories of the persons and the gram per deciliter of blood, venous blood. Adult male it is 13 gram per deciliter. Adult female non-pregnant 12 gram per deciliter. Pregnant females it is 11 gram per deciliter. Children 6 months to 6 years is 14 gram per deciliter. So interventions is you can give a iron and folic acid supplementation on daily basis. So National Nutritional Anemia Prophylaxis Program is based on daily supplementation of IFA tablets for the children between 1 to 12 years to prevent mild to moderate anemia, and also you can go with high dose of iron and blood transfusion if necessary, and if the hemoglobin is between 10 to 12 the other investigations can be given. The other investigation means iron and folic acid supplementation, nutrition supplementation can be given to correct the anemia. So this is the interventions to prevent and to prevent the anemia and to promote measures to maintain the health status. Next is in mothers, 1 tablet of iron and folic acid contains 100 mg of elemental iron. That means 300 mg of ferrous sulfate and 0.5 mg of folic acid. And children's, it contains 20 mg of elemental iron, that is 60 mg of ferrous sulfate and 0.1 mg of folic acid. Next is iron deficiency disorder. So iron deficiency disorder leads to a much wider spectrum of disorder, commencing with the intrauterine life extending through childhood to adult with the serious social implications. So some of these iron deficiency disorders like goiter, hypothyroidism, then is iodized salt and iodized oil can be inculcated in your food items if you have this iodine deficiency disorders. So you can go for iodized salt when compared to a common table salt. And iodized oil can be given for controlling goiter. In intramuscular injection it is given. Next is iodine monitoring, that is done in water whatever they are drinking, and determination of iodine in salt. And mass communication you can give as a nurses as health education and public awareness in order to improve the iodine in your food, that is using the iodized salt in their food. Next is endemic fluorosis. So dental fluorosis is commonly due to the excess fluoride that is ingested during the first 7 years of life. So the calcification, that is during the tooth calcification, if they are drinking the fluoride water, it may lead to this symptoms. So the white appearance of the teeth looks like a brownish. Next is skeletal fluorosis. So when the increased amount of 3 to 6 mg per liter is there of fluorosis, it can lead to a permanent disability, and that to a deposition of fluoride in the skeletal muscles. So this is dental fluorosis, that is deposition in the teeth, and this is a skeletal fluorosis. So the fluorosis get deposited as skeletal and causing the physical disability. So for this we can give the interventions like changing of water source, that is the water which contains high amount of fluoride can be changed, and also you can when you compare between the stagnant water and running water, the running water have less amount of fluoride content. And also if there is a water with fluoride, means you can add lime and alum as a chemical treatment. Another measures like drink non-fluoridated waters, use of fluoridated toothpaste not recommended for child up to age of 6 years. So till 6 years of age you should see that the fluoridated paste is not being used by the children. Next is Lathyrism. It is a paralyzing disease of human and animals. In the humans it is referred to as neurolathyrism because it affects the nervous system, and in animals it is Lathyrism because the pathological changes occurs in the bones resulting in skeletal deformity. So for this condition, what intervention you can give is, that is administration of ascorbic acid 500 to 1000 mg per week, and banning the crop which contains lentils, banned Lathyris in all forms, that is either whole or split or flour. You should prevent the adulteration of that particular dal. Next is can improve the socio-economic status. Next is removal of toxin stepping method, that is a large amount of pulse is soaked in the hot boiled water for 2 hours, then water is drained off and the pulse is cleaned out with the clean water. So then after cleaning, the pulse can be used for the consumption. And education to be given in order to prevent the food adulteration, and also how to use those pulses before using for the cooking. You have to boil it and you have to see all the chemicals is being washed off. Next is obesity. So most prevalent form of malnutrition, it is abnormal growth of adipose tissue due to enlargement of fat cells or combination of both. So obesity, when a body weight is 20% more than the desirable weight. Overweight is when the body weight is between 10 to 12% more than the ideal weight. So factors contributing to the obesity is age, sex of the babies, genetic factors, physical inactivity, socio-economic status, eating habits and alcohol. So the direct cause of overweight in India is due to the lack of physical activity. So nowadays most of the babies are just using only the phones, and they have only increased screen time when compared to the physical activities. And high number of stress, even a normal activity is being considered as a stress, and they just put upon extra weight due to that, due to the hormonal changes. And high rate of economical growth. So when the economic growth is higher, they also consume more amount of food. And also sedentary lifestyle is being followed in nowadays for a very long period of time, by not only by the children but also by the adolescents, everyone. So these are some of the factors which is being contributing to the obesity. So next we'll see about how to control the obesity is eat food according to the body requirements. So as per recommended dietary elements, you have to eat the food. At least 3 to 4 hours interval between the meals. Avoid in between snacks. Avoid intake of fatty and fried foods. You can also avoid the junk foods, and more amount of leafy vegetables which contain high proteins, iron can be inculcated. Next is decreased appetite in small children. It is a main cause of decreased appetite. There is a undernutrition. Next is heartburn, that is due to certain foods or taking medicines or a result of surgery. The geriatric persons will have a heartburn. Next is sore mouth or throat. It is also one of the major reason for not taking adequate amount of food. So next is dryness in the mouth. It can make certain foods more difficult to eat. Fever, medicines and mouth infection can cause dryness. Next is nausea. So when you have nauseated, it will cause a decreased amount of food intake. So nausea is also one of the cause for less intake of food. Next is diarrhea. So when there is an increased number of stools, the amount of fluid and stools are both is increased. There will be a dehydration status in the babies, and also diarrhea which causes the less intake of food due to the fear of again going to the restrooms. Next is constipation is also a major cause of one of the reason for decreased intake of food, that is constipation can be caused by medicines and not drinking enough fluids. And when geriatric populations, when we see, they have food allergies and the swallowing difficulties. So some of the food contains food causing allergy causing foods are like shellfish, eggs, peanuts, milk. So these all are some of the food which is also known as a food hypersensitivity. So when the person is having food hypersensitivity, they will avoid that particular food. So based on these nutritional deficiencies, the government has launched many nutritional related programs like Integrated Child Development Service Scheme. It is being launched in the 2nd October 1975. The beneficiaries are children below 6 years of age, pregnant and lactating mother, and adolescent girls, and the women age group between 15 to 44. So the main objective is to improve their nutrition level, and also the services provided by the Integrated Child Development Scheme is giving the supplementary nutrition, vitamin A, iron and folic acid, immunization, health checkup. Routinely you do the health checkup, and if they have any major symptoms, they will do the referral services. Treatment of minor illness will be done. Nutrition health education to women regarding the nutrition pattern and also recommended dietary elements. Preschool education of age group between 3 to 6 years. So between the 3 to 6 years, you provide a preschool education to them, and you give the nutrition by giving education, as well as you are going, the ICDS is going to give the nutrition. Next is vitamin A prophylaxis program. It is being launched in 1970 by the Ministry of Health and Family Welfare. The main component of this program is to control the blindness due to the vitamin A deficiency. So single massive dose of oily preparation of vitamin A containing 2 lakh international unit orally to all preschool children is given in a mandatory pattern. Next is prophylaxis against nutritional anemia. So it has been launched by the Government of India during 4th 5-year plan. Distribution of iron and folic acid tablets to the pregnant women and young children between 1 to 12 years of age. Next is iodine deficiency disorder program. In order to reduce this iodine deficiency disorder program, it is being launched in 1962. The main focus is to replace the common salt with the iodized salt, and using the iodine in all kinds of food wherever it is possible. And also 1 ml injection is being iodized oil to those suffering from iodine deficiency disorders. Next is midday meal program. It is being launched in 1961. It is main event is to attract more children for admission to schools. So they will give education to, they will give a primary education to the children, also provide a midday meal program. That is, they will also provide a food, and that food contains all kinds of nutrients containing carbohydrates, proteins, fats, vitamins and micronutrients. Next is Balwadi nutrition program. So nutrition support to preschooler children. It is being started in 1970 under the Department of Social Welfare for children age group between 3 to 6 years in rural areas. So food supplements like 300 kilocalories, between 1000 kilocalories we are going to initiate. Next is wheat based nutrition program that is being implemented for the children below 6 years of age. So National Food for Work, the provide supplementary wage, employment and food security. The scheme will provide 100 days of employment at minimum wages to the person. Next is National Water Supply and Sanitation Program. It is being launched in 1954, provides safe water supply and adequate drainage facility for the entire urban and rural population. Next is minimum need program. It is being launched in 1974. The main is to fulfill the basic needs of the individual. So you are going to provide the elementary education, adult education, nutrition, house for landless laborers, rural health, rural water supply. So these all are the some of the components of minimum needs program. So as a government launch, the main reason is to fulfill their basic need, that is minimum need is being fulfilled. Next is 20 points program being launched in 1975. The main objective is to eradication of poverty, raising the productivity, reducing the inequality and also improving the quality of life. So by just having these 4 points in the mind, so main is to raising the productivity. There is an increased amount of population. For that to compensate, we are also raising the productivity. Next is, by this conclusion, we have seen about the nutrition problems. We have seen both undernutrition and overnutrition. So the food is the basic need for every individual. When a basic need of the individual is being fulfilled in a proper way, most of the disease condition gets cured, and also they will have a betterment of life. And when the pediatric population fulfills the nutrition pattern, they will have a healthy adulthood. So if you have any doubt, kindly drop down in the comment box.